Welcome back to another presentation by the Sexperts. My name is Jess, and today in our intro series of Everything You Should Know About Periods, we'll be discussing what it means to have your period and cover some basic need-to-knows. You may be asking yourself, what actually is a period? Having your period, also called menstruation, is when tissue and blood from the inside of your uterus comes out through your vagina. This is something that usually happens monthly. There are a lot of terms out there people use to describe menstruation or periods. You may have heard of some of these terms before, like the monthly visitor, or the red tide. But for us, it is important to teach you the proper terminology. Having a period is nothing to be ashamed of, and we need to normalize using the correct terms for what is going on with our bodies. Also, a lot of these terms are very gendered, and we want to shift this kind of language to be more inclusive. We need to acknowledge that not all women menstruate, and not all menstruators are women. What actually happens in our bodies during the menstrual cycle? Your menstrual cycle is your body's way of preparing for possible pregnancy each month. And if you're not pregnant, that is when you get your period. Your whole menstrual cycle is controlled by a variety of different hormones. Let's have a closer look at the structures. This is a uterus, and a variety of important structures such as your ovaries, the fallopian tubes, your cervix, and your vagina. The ovaries are the egg-shaped structures extending away from your uterus. The ovaries hold eggs needed to become pregnant. These eggs are super tiny and not visible to the naked eye. Hormones during your menstrual cycle help these eggs to mature so they can be ready to be fertilized by a sperm cell. This happens about halfway through your menstrual cycle. The hormones send a signal to your ovaries and tell them to release a matured egg. This is what we call ovulation. The hormones that help your egg mature also thicken and sponge up the lining of the uterus. So if the egg does get fertilized by a sperm cell, it has a nice soft place to begin a pregnancy. The lining of the uterus is made of blood and tissue and contains a lot of nutrients to help a pregnancy grow if needed. The days leading up to ovulation, which is when an egg leaves your ovary, are called your fertile days. These days usually are when your chance of getting pregnant is the highest. Usually this happens around day 14, or 14 days before your period starts. But based on the length of your cycle, this can be different for everyone. In young people, periods can be quite irregular and unpredictable to plan for. That's totally okay and normal. Usually, after a while, this settles in and becomes more regular. If there is no pregnancy, this cushiony, thick lining is not needed by your body. It breaks down, and all the tissue, nutrients, and blood leave your body through your vagina. And this is what is commonly referred to as your period. This usually lasts between 2 to 7 or 8 days. If you do get pregnant, your period will stop and come back when you're not pregnant anymore. All these events that take place are divided into 4 phases or stages of your menstrual cycle, and each has its own name. There's menstruation, or the menstrual phase. There's the follicular phase, ovulation, or the ovulation phase, and lastly, the luteal phase. And we know all of this seems like a lot of information at once, but don't worry. You're just learning the basics, and during our next video, we'll dive deeper into each of those phases. Also, we want to equip you with the knowledge you need to understand the color of period blood. This color can vary, but it's not always a reason to be concerned. Just something to pay attention to and be mindful of. Note that bright red cranberry color signals a healthy and steady flow. The more you learn about your own body, the better you can take care of yourself. You also may wonder, when in life does all of this happen to me? When someone born with a uterus reaches puberty, which usually is between the ages of 8 and 14, they will get their first period. Everyone goes through puberty at their own pace, so it's quite difficult to predict when exactly someone will get their first period. However, if you don't get your period for the first time by the time you're 16, we recommend scheduling a visit with a doctor or nurse. Leading up to your period, some people may feel symptoms we refer to as PMS symptoms, like headaches, bloating and cramping, and you also may be feeling all sorts of emotions during this time. This is why it is especially important to take care of yourself, physically and mentally as well. Now, will your period ever stop? Other than when you're pregnant, the answer is yes. There's a time in your life we call menopause. Menopause can happen any time in a person's adult life, most commonly between their 40s and 50s. But just like puberty, this is different for everyone and can happen earlier or a little later sometimes as well. While menopause might happen for people at once, often it can take a few years, as it is a transition and people experience changes in their period gradually during this time. What happens is that a person's ovaries stop releasing eggs, and because of that, the person no longer can get pregnant. Now that we covered the basics, you are ready for part 2 of our Everything You Need to Know About Period series. Part 2 will be all about the phases of the menstrual cycle in depth. Would you like to know more? Reach out to us, your ACR Health CAP educators, aka the Sexperts, or reach out to your local health center to ask questions about periods. Be on the lookout for the rest of the series, where we will be going through other topics related to periods, such as what products to use and how to use them. If you have any questions, please comment below or contact us on social media. Don't forget to like and subscribe for more videos on sexual and reproductive health.